I think we have to think about it in terms of a short-term and a longer-term adaptations that we need to make to be able to handle air pollution. Because we've heard about how the solutions are going to take time to have effect. I think in the immediate case, we have to be aware that if we have, well, I think we should be looking at AQI levels every day as if they're the weather report, so that we're acutely aware of what happens when we go out of our house and what happens if we want to exercise outside our house, and how we need to modify those activities if the AQI levels are poor. So you may like to wear a face mask, for example. Try and use an N95 if the AQI levels are very bad, and especially if you have some kind of chronic disease. So if you already have asthma, or you have COPD or heart disease even, you should be wearing an N95 in bad air quality levels. You should even think about whether you really need to go out that day. You really need to be in that environment at that time. Of course, AQI levels can change throughout the day, so there may be other times in the day that it's better to go out. Just like we would go out to play a football match during heavy rain, we shouldn't be playing football when it's very bad air quality. There is interesting evidence that if you are well, and you don't have any chronic disease, you're not a young person who we've heard are at special risk or very elderly, then exercising, especially exercising to go to work or as a form of transport, so using a bike or walking, can actually be better despite the poor air quality outside, because you're benefiting from exercising your body at that particular time. But this is not the case for all people. And I think we, you know, as well as the high sensitivity groups, we know that Pakistan's air quality levels are not really there that we can compromise and start walking on the street to try and gain the value of exercise. Rather, you can go to the gym and benefit yourself by looking at these other risk factors for chronic disease: exercise, nutritional intake, and your tobacco use, which is another big driver for chronic disease. I think the other thing I want to say about personal level immediately is that if you are having frequent symptoms of poor health, so you're frequently getting chest pain, and you're frequently getting breathlessness or cough, you should see your doctor, because maybe actually you have asthma or COPD or some kind of disease that should be treated. And in those situations in particular, but I think that many policies now advocate this as well, you may like to take immunizations for flu as the winter season comes. Pneumonia vaccination is also available, but flu vaccine should be taken every year. And it is going to help to protect you, especially if you have chronic disease. There's well-established evidence to support this throughout the world. So those are some important things that we should be looking every year as the air pollution season increases. But I think in the longer term, we've heard a lot today about sensitization and an understanding. So looking at AQI and understanding how that connects to your health is really important. And we found last year, when we went and asked a lot of adolescents about this, that people were not really very clear between the relationship between air pollution and health, even though in a day like today, we have really been able to talk about it repeatedly and talk about it in a convincing way. But there's a huge population of people who are not so clear about this, and there needs to be many more sensitization activities at multiple levels, some of which are already going on. We did one that's just recently completed on social media, focused at young people who are ultimately the change makers of our society. Thank you.
So much. It's very valuable advice for the people, also individuals, a family. And now I go back to Panina again, and you give us a very interesting insight of the impact of pollution to children's health. Could you tell us more about the main recommendation to to reverse the situation and build a healthy future for every child in Panina.
Thank you, Dr. Dapeng. First of all, we need prioritization. Air pollution must be treated as a national priority and an emergency, not just a public health one, but also a social one and a child rights one. This is fundamental. Until it's treated as a national emergency, it won't receive the attention that it requires. It'll be piecemeal rather than a more holistic and transformational approach. We also need to enforce and adopt the air quality standards that are recommended by the World Health Organization and have the monitoring systems in place to ensure that those are also adhered to. These are the basics upon which we can then monitor on a daily basis and start creating that awareness. Speaking of awareness, every child and person in this country should be aware of not only what air pollution is, but on also the concrete actions that they can take at a household, and an individual level, and a community level to address it. It needs to be included in the school system, in the curriculum, whether it's public or private. But let's not forget there are 26 million children who are of school age who aren't in school. But they too need this information. It has to be known at a community level. So every single community, whether you're in a rural community in Balochistan or you're in an urban slum of Karachi, you need to know about this and be equipped with the awareness to know what to do about it. There are many solutions that are available that can tackle the specific contributors, whether that's the transportation industry, whether that's the agricultural industry, whether that's urban planning and having planting more forestation and parks. There are so many solutions out there, but it requires a concerted plan of action that is really going to the heart, and that takes people into its account. There is strong evidence in so many areas that when people are aware, they will themselves take action at the individual level, which will contribute positively to the change. It is not sufficient, but it is a vital aspect of the solution. So let us invest in those, and UNICEF stands ready to continue to partner with government, with society, with civil society in those solutions, in that forward action.
Thank you. As I say, Nas already answered the second question I asked him. So I want to thank all the distinguished panelists for the very fruitful discussion. I'm sure our audience will take this valuable insight into consideration, continue building a health future for children. As I said at the beginning of this panel, Save Life offer a health future for our children and our grandchildren. This is in our hand. Shukriya, thank you. Thank you, everybody. Patience and for still here. Thank you.